Fair Use Act Disclaimer.
Yeah, it's Moana, baby.
Hey there mga kaPTids! It's me Nicole and my partner Elise. So we are going to be your guide for today's Moana series, episode 8, part 1. So for today, we are going to talk about the muscles of our head, and the references we have used for this episode are Hub, Tortora, and Snell. So if you're ready to explore the wonders of Moana, what are you waiting for? Join us!
Let's begin with the bones of the head that you must remember. There are two major classifications. First are the 8 cranial bones that protect and enclose the brain. Second are the 14 facial bones which forms our face. The cranial bones include the frontal bone which forms the forehead and the roofs of our eye sockets, as well as the anterior part of our cranial floor. Next, we have the parietal bones which forms the sides and the roof of the cranial cavity. The most important thing about this bone is that its internal surfaces accommodate the blood vessels from the superficial tissue covering of the brain, which is called the dura mater. Next, we have the temporal bone, which are the inferior lateral aspects of the cranium. Next, we have the occipital bone, which forms the posterior and the base of the cranium. Next, we have the sphenoid bone, which is the middle of the base of the skull. Lastly, we have the ethmoid bone, which is the sponge-like bone that is situated in the anterior part of the cranial floor. Now, for the facial bones, we have the nasal bones, which are the small triangular-shaped bones that form the bridge of our nose. Next, we have the lacrimal bones, which are the medial wall of the orbits. The palatine bone, which is the posterior portion of the hard palate. The inferior nasal concave, which is found just inferior to the ethmoid bone. And the vomer, which is the floor of the nasal cavity. We also have the maxillae, which are the upper jaw bones, and the zygomatic bones, which is also called as our cheekbones. We also have the mandible, which is our jaw bones. Now, let's move forward to the muscles of the eyelids. We have the ocularis oculi, where the palpebral part closes our eyelids and the orbital part turns the skin around the eyes into orbits. Its origin is mostly from the nasal part of the frontal bone inserting in the skin of our orbital region, innervated by the 7th cranial nerve, or what is known as the facial nerve. Next muscle is the levator palpebral superioris, which raises the upper lid. Its origin lies from the orbital cavity and inserts to the anterior tarsal plate and the skin of the upper lid, innervated by the 3rd cranial nerve, or what is known as the oculomotor nerve. Next on the list, we have the muscles of the head. First is the occipitofrontalis, which has 2 bellies. The occipital belly originates from the highest nuchal line of the occipital bone, while the frontal belly originates from the superficial fascia of the eyebrows. It inserts in the epicranial aponeurosis and it is innervated by the facial nerve. It is responsible for the raising of the eyebrows.
Now let us talk about the muscles of our facial expression. So first, we have our orbicularis oris. So this muscle originates from our mandible and maxilla, and it inserts into our oral orifice. So this muscle functions in compressing our lips. So next, we have our levator angular oris. So this muscle originates from our oral orifice and it also inserts into our oral orifice. So this muscle functions in separating our lips, just like when we are talking. So we have next the buccinator. So this muscle functions in compressing our cheeks into our teeth. So this muscle originates from the mandible, the maxilla, and the pterygomandibular ligament. So we have next the procerus. So this muscle originates from our nasal bone and it inserts into the skin between our eyebrows. So this muscle functions in wrinkling the skin between our eyebrows. So I will be demonstrating it and I hope you will laugh at me. So it goes like. So next we have the corrugator supercilii. So this muscle originates from our superciliary arch and it inserts into the skin of our eyebrows. So this is also called the frowning muscles because these forms wrinkles in our forehead. Let's talk about the dilator of our lips. So first we have our zygomaticus major. So always remember that this muscle is your smiling muscle. So every time you smile, that's the muscle that is functioning. So it originates from the lateral part of our zygomatic bone and inserts into our upper lip. So next we have our zygomaticus minor. So this muscle elevates our upper lip so that our upper teeth may be seen. So this muscle again originates from the lateral part of our zygomatic bone and inserts into our upper lip. So next we have our mentalis. So this muscle is also called the pout muscle because this includes the protrusion of our lower lip. So it's like you're doing the pity face. So this muscle originates from the incisor fossa of our mandible and it inserts into the skin of our chin. So lastly, we have our risorius. So this is also called as our grinning muscle because it functions in extending the angle of our mouth laterally. So this muscle originates from our zygomatic bone and it inserts into the oral aperture. So the muscles of our facial expression and these dilator of our lips are all innervated by the facial nerve. Let's talk about the muscles of mastication. So mastication is basically chewing. So every time we chew our food, these are the muscles that are active. So let us remember the word item. So item stands for internal or medial pterygoid, temporalis, external or lateral pterygoid, and lastly, masseter. All of our muscles of mastication are innervated by the mandibular division of our trigeminal nerve, temporalis. So this muscle functions in elevating and retracting our mandible. So this muscle originates from our temporal fossa and it inserts into the coronoid fossa of our mandible. So next we have our masseter. So this muscle functions in elevating our mandible so that our two layers of teeth will meet. So this muscle originates from the zygomatic arch and it inserts into the lateral ramus of our mandible. So next we have our lateral pterygoid. So this muscle functions in pulling the neck of the mandible forward and it originates from the greater wing of our sphenic bone and it inserts into our neck of the mandible. So lastly, we have our internal or medial pterygoid muscle. So this muscle functions in elevating our mandible and this muscle originates from the tuberosity of the maxilla and inserts into the medial surface of the angle of our mandible. Our additional condition, we will talk about the Bell's palsy or which is also called as the face paralysis. So this is a unilateral paralysis of the muscles due to the damage to facial nerve or cranial nerve number 7. So when we say unilateral, it means that only one side of our face is affected. So this condition causes the patient's inability to wrinkle the forehead, to pucker the lips, or just all the actions that are performed by the muscles of our expression. I guess we have already tackled all the important muscles we have to talk about today. So before anything else, we would like to remind you of these tips. So first, you can create your own mnemonics or own acronym of the lesson or each muscle so that you will be able to remember and memorize easily. Next, you can always review all your pictures or your flashcards so that you can familiarize yourself with the location of the muscles. And lastly, you have to always review and study your muayna because we are going to need it everywhere we go. So I hope you had fun today, and always remember to do your best and have fun in learning.